Hey everyone, Rob Sege from the Wolf and Fresh Radio. I'm the program manager here, and I'm with a great crew from CMHA, and we have the Road Ahead Mobile Wellness Clinic that your money has helped make a reality. We'll introduce the crew here.
Jack Beach, Manager of Community Engagement and Education with CMHA. And I'm Jeff Cadence. I'm the Program Manager for the Road Ahead Mobile Wellness Clinic.
I'm Teresa Mabry. I'm a clinician for the Road Ahead. I'm Kara Smith, and I'm one of the nurses on board.
And we're going to go inside in just a second, take a look at this incredible unit. But as many of you know, and many of my donors know, we've been raising money for the past number of years with Ride, Don't Hide in support of mental health awareness each June. And last year, this was a key initiative for the funds that were raised. And your money helped make it a reality. So thank you for your support. We're going to go inside, take a little tour, learn more about it and why it's so important to have in this region. And again, thank you for your support. Come on in, let's take a look.
Okay, so
Jeff, tell us why this initiative has been so important for CMHA.
Well, what we have come to realize over the years is there's a big difference between access to supports and services from people living in more urban environments like Peterborough or Lindsay or Coburg, or more rural, smaller, remote communities where there just aren't services available, close to where people need them. So this project was an attempt to try and alleviate that difference a little bit, make it that people who are living in remote areas in Peterborough County, Northumberland County, the city of Kawartha Lakes, and Haliburton can access what they need in terms of supports for mental health, for addiction, substance use concerns, the full range of things that you would be able to get help with if you lived in a larger center.
Sure, there's a large geographic area that's under your catchment, and
Yeah.
I imagine it must be quite difficult for some people to even get transportation to and from the city. So
Yeah.
rather than them come to you, you're bringing the services to them.
Absolutely. One of the things that we learned when we were doing the research stage for this project, we were doing a lot of consultations, a lot of meetings in small communities, and transportation was the first thing people tell us about. It's like there's no public transit to small towns and remote areas, and a lot of people who are struggling with a number of things are also often struggling with the ability to get themselves to a larger community to see a specialist or see a psychiatrist or see a counselor. Oftentimes, even if they do have a vehicle, with the price of gas these days, it's a choice between putting fuel in the truck to get to the appointment or putting food on the table for your family. We know where most people are going to opt in that
And they
case.
choose the food versus perhaps taking care of their mental health.
Yeah, absolutely. So that was the number one barrier people had identified, coming right up along with the absence of services local in one's local community. So
what do we have back in this area? Walk us through a little bit of what we're seeing.
So this is one of our two consultation rooms on each clinic. As we mentioned, we have two clinics. This one is a little bit specialized back here because we do have our wheelchair lift, so that
Can I pull this back?
Yeah, hiding behind the curtain there.
So fully accessible.
Yeah, so if a person needs full accessibility, we can lift them onto the building, and the doorways all meet code for accessibility, and the washroom and that sort of thing. So in this room, if anybody needs any support from our nurses as well, we would be booking them an appointment in this room because we have a medication fridge and we have a hand wash station. We have some vital signs equipment, so that some of the basic health needs that come along with mental health or addictions concerns can be met in the remote environment as well. In both rooms, we're set up to have video connections with specialists. We do offer psychiatric consultation, so if it seems like an assessment is appropriate for what the individual needs to see a psychiatrist, we can set that up in a video appointment.
Amazing.
And then that psychiatrist would send recommendations back to the referring doctor. But they may also say, okay, we're gonna recommend a certain medication. However, we need to know what your vitals are and do a bit of a health checkup. And our staff nurses can do that aspect of in-office care, and then the doctor can be consulted remotely.
And that's where this equipment comes into play.
Yeah.
I mean, this is something you must be truly proud of.
Mm-hmm.
Just to see it come to fruition. And I know when people donate their money and they want to know, where's my money actually going? And is it really doing the things they say it's going to do? And this is a testament to
Absolutely.
money being put to the use that it said it was going to be put to, and it's truly going to help people.
We've had a ton of support in the communities, largely because people, when we talk to them about what services are needed, what are the gaps, how do we need to fill the gaps, people hear about the idea and they're all over it. They say, yes, this is exactly what we need. How can we help? And people have been jumping on board by either hosting their own events and sending the proceeds our way, or just making straight up donations. We've got an itinerary in each county where we stop off in different locations on scheduled days. When an individual is looking for help, they can call our direct line. They do so in the middle of the workday. They'll get a live answer and they'll enter into their assessment interview right there on that call. When we determine what help they need from us, we'll then figure out when are we closest to them. Right. Say we'll be, in your town or the small town right next to you next Tuesday. Can we book you an appointment to meet a clinician on that day? And then we take it from there, and people enter into service. They can also get a hold of us by way of our website. There's a little form that they can fill out, and then that comes straight through to that same person who would do that interview, and we get back to you right away.
Yeah, that's there's one thing I've learned is that we all have mental health. We all have our good days, we all have our bad days,
Yeah,
and
absolutely.
the stigma needs to change. We need to have conversations. We need to let people know that it's okay to not be okay, and that we're working on building resources for people in our area so that they can get on that road to mental health.
So thinking that on the one hand we're being discreet, and on the other hand we're trying to push people's understandings, just exactly as you said, around how we all experience mental health. We can all have some times where we need some support, and making that more understood and accepted, as other aspects of health and physical health are understood and accepted and not judged. So
it really is something to not be embarrassed about. Which it's a shift in the paradigm, and as CMHA, I've been pretty open about my mental health struggles, and I had a brother who died by suicide, Chris, and each year I ride in memory of him and in honor of his son Dawson. And it's okay to not be okay, and it's okay to talk to other people and be vulnerable about that, because again, we all have our good days and our bad days. Some are more serious than others, and it, as we know, mental health and illnesses cover a wide spectrum. Nobody chooses it. Nobody chooses it, but what you can choose is to reach out and take advantage of the resources available. Jack, this is amazing, right?
It's pretty incredible.
I'm so proud of everything you guys have accomplished. What an amazing vehicle, a resource to have for the community. Congratulations.
Thank you. And you know what? I always say this, and I don't say it lightly. We don't get this without the donors, without the support of the community, without partners like Chorus. This doesn't exist. And sometimes people say, you use hyperbole to make a point, and that's what fundraising is. But the reality is, we're sitting in a vehicle that has been paid for in large part due to the donations and the money we raise at events like Ride Don't Hide.
It's just so grateful to all the donors. I've been riding for, I think, 6 years.
Since the beginning.
We had that 1 year off with due to COVID, unfortunately, but year after year, people coming to the table who don't even live in Peterborough on the Kawarth, is people back home in the Cornwall area who have been so generous to support this cause that's been close to my heart, and to make things like this mobile wellness clinic a reality. It's thank you. Be proud that your money is being put to good use. And helping people in real need of assistance.
But these statements, these conversations, we're going to make them louder and prouder, and continue to show, look what we can do. Look what we can do when we come together and work together.
Now, something else that's been very close to my heart, and we raised money for a few years back with Ride Don't Hide, as well as we attended where I had an opportunity to speak at an event a few years back where $10,000 was raised in just one night to go towards the creation, and I don't know if this is the official name you've settled on, but it was for survivors of suicide. And as many people know, my brother died by suicide in 2016. You know, had things been different, I don't know, but I do know what the after effects are from a decision that gets made, and it does have a long-lasting effect on family and friends, and you know, he will not be forgotten. But the coping with that type of tragedy is very difficult. You know, when I think of my mom in particular, and my father, you know, he's in their hearts every day, and they still struggle with it very much to this day. That said, we started looking at the introduction of a program for people living with
The ripples in the pond.
the ripples in the pond. So tell us about that.
Yeah.
What have we managed to create here?
I remember talking with you way back in 2020 when we were getting Ride Don't Hide ready in the middle of a pandemic. We're thinking, how are we going to do this? And it turns out to be our most successful fundraiser to date for Ride Don't Hide and cycling events. That we took that money, we rolled it right into our Survivors of Suicide program. So partnering with hospice services, able to offer group-based supports with clinical care and sort of mental health care and support to the individuals that are impacted following that loss. And I couldn't put it any better than you just did. And I think a big reason why this has been so successful is you being so courageous and sharing your family story and your journey and the impact it's had. And you really led a lot of people to this program to make it created. So I again, I don't say that lightly. But we have a program now where these people that have been impacted by a loss of suicide can come together. They can talk about their experiences. They can learn from, you know, each other's losses and grief and support each other along the way. And it is, I keep saying essential, but I mean, it was so underserviced. It's such a necessary need, unfortunately, but it's just so encouraging to know that it's there now. And partnering with hospice to deliver this quality care, I'm just so glad that we got to be a small piece of a really important program in our community. We can pretty safely estimate about 4,000 suicides per year in Canada. And we have data up to about 2020. So our 2020 data is in line with that. But what we saw that was different in 2020 was that a younger demographic was now experiencing a higher risk. So that 20 to 30 age range being really heavily impacted by COVID. And I think as data continues to become publicly available, we'll look to years like 2021 and 2022 and see how things have changed. But what hasn't changed for 15, 20 years, pandemic or not, estimating 4,000 reported suicides per year. And I mean, it's a support that maybe a number that's underreported because of different reasons, but the support is needed.
Yet, to this moment, our country has not made this a priority, and they need to make it a priority. People are dying, people need help, and your people are doing great things to help them, so thank you.
I think about one of the exciting changes, and I think that it's come about because of conversations like we're having and like you've had for years and advocated for, is now a national suicide hotline for Canada coming in 2024. These changes don't happen without the conversations and frankly, the really hard conversations that you've had and the really hard advocating you've done.
Thank you again. I'm very excited. We know we can't say anything here yet today. It's too early, but we got plans for.
We got exciting. Can I look at the camera now?
Yeah. You do your thing.
We got exciting news. I'm not gonna reveal it yet, but bigger, better, more local than ever. Coming up soon. Big fundraising news.